All right, welcome everybody. Thanks so much for joining us today in person and online. I'm Eugene Richardson, Assistant Professor in the Department of Global Health and Social Medicine, and it is my honor and privilege to introduce Dr. Seye Abimbola to present to us today on dignity and knowledge in global health. Seye is a health systems researcher from Nigeria. He is an associate professor at the University of Sydney, and he was also named the Prince Claus Chair in Equity and Development at Utrecht University in the Netherlands. He's just received a nice, juicy grant from the Australian Research Council on studying dignity and knowledge production in the realm of epidemiology. And for me, he's an inspiration in really over the many years showing us how we can use our tools of understanding social phenomena in different ways, in ways that look to justice, look to structural determinants, things championed by our department and our late friend Paul. It's very special to have him today to share his wealth of knowledge with us. His last OLA in Yoruba means wealth. So he's going to share that wealth with us today. And I just want to say, thank you for spending some time with us. You've really been a huge, not only inspiration, but instrumental in the way I see the world. And I'll conclude by saying he's the editor-in-chief of the BMJ Global Health, which has been a friend to papers and investigators that are working in this area of thinking about what decoloniality might look like in global health. And I also appreciate how you've really steered that through the journal, through social media, through book recommendations. And so it really is an honor to have you here today. So without further ado.
Yeah, thank you for having me. I've been here since Sunday. I've had a great time being here. If I was doing this in Australia, I will start by acknowledging the traditional owners of the land. So I will do the same here. So I want to pay my respects to the owners of this land and the Massachusetts people, and acknowledge their long-standing practices and traditional knowledge, making, using, and sharing. So what I'm going to talk about today is a piece of work that I've been doing for the past 2 years, and you see why it's taken 2 years to get to a point where I will share it with you. And there's this line by T.S. Eliot, whom I realized yesterday used to be here, which is a raid on the inarticulate. So in his poem, his sort of book-length poem, 4 quartets, there's this expression toward the beginning where he sort of said, so here I am, having had 20 years largely wasted trying to use words. Every attempt is a different kind of failure. And so each venture is a new beginning, a raid on the inarticulate. And what he meant by inarticulate here is that which is difficult to articulate. And you can imagine different ways and reasons why certain things are difficult to articulate, which is why I am a huge fan. I'm very grateful, more specifically for the work of Miranda Africa, who coined the expression epistemic injustice. Because in many ways, it is a kind of injustice that it's difficult to articulate. And I will go ahead in the following slides to explain why, but which that means that articulating it in the first place is an act of justice, sort of just giving a name to this kind of injustice that makes it difficult for you to even say what you think, or when you say what you think, for you to be understood and taken seriously. It's a difficult kind of injustice to articulate, and it's good that it has a name, because that in many ways is the beginning of articulating. And it's also in many ways why I'm been very happy. And Jean was describing earlier that I'm editor-in-chief of BMJ Global Health. I've been very happy about what I started, half jokingly, to call the complaints literature. But now I think I'm taking that label more seriously. in global health. I've been very happy that it's accumulated over the past 5-6 years. I think it's a good thing in many ways because it's also another version of a raid on the inarticulate. That people have been trying in different ways to express that which unsettles them, but in many ways, often that which they have no name for. And I think it's time, I've felt for a while that it's time to even begin to try and consolidate that literature, sort of try and identify its contours and perhaps highlight more clearly some of the strands that are emerging from it. And so I set out with a group of friends to try and do that. And we started 2 years ago, and it's taken a long time to do it. Partly because I've been too busy doing other things, partly because we are spread across the world, and partly because I was Prince Claus Chair when it started, and I was in the Netherlands, and it was COVID, and so lots of things have happened in the interim. But what we did was to try and synthesize that literature using Fricker's framing of epistemic injustice, which I will get to later, but modified. Again, I will describe that modification later. But I think the first thing to do when we're thinking about how to synthesize the literature on fair knowledge practices in global health is first to be very clear what global health means. And I know this is an over-debated issue, and I can't have enough of it. I want more people to debate what global health means, because in many ways it's both nothing and something at the same time. And I've often felt that the word global is a big distraction from what we mean when we say, or what we should mean when we say global health. That perhaps health is enough. In the same way that perhaps when we say climate change, we don't say global climate change, and we recognize immediately that there's something global, inherently global about it. Anyway, so when I think about what global health means, I often focus primarily, especially in the context of knowledge practices, I focus primarily on distance, on how it is that all our efforts to reduce inequities in health are carried out at a distance. And it could be a physical distance, which is that you're in the US and you're working with someone in Nigeria or in Ghana, or you are in Harvard and you're working with indigenous peoples of this land. It could be physical in that sense. It could also be very social. And you can also see how those two examples are also social, but also within the same physical space. You could have different social markers that create distance. And I've come to think about this distance, or this sort of, to characterize this distance in terms of the center and the periphery, because there is, in that distinction, a side that has power and is at the center, or imagines itself to the center, or actually occupies that center. And there's a party that belongs in the periphery, or at least identifies with being in the periphery, or is imagined as being in the periphery. So there is usually that distinction in our efforts in global health. And that distinction comes with a very important knowledge consequence. When we do global health, I often use this graphic because it just makes it easy to talk about, that people in place B or from place B or in situation B imagine that what works in B or for B will work in A, and so they go and implement it, sometimes impose it. Or that a way of understanding the world, or of reality, of understanding reality in place B also applies in A, and then of course it is applied, such as it is. Whereas in almost every instance, the periphery knows better, and the periphery knows what works for it, certainly. And I've often remarked that the periphery knows better than the center, full stop, not just about itself, but also about the center and itself. Because when you are at the periphery, you have to figure out how to operate in the periphery, but also in relation to the center, in ways that the center doesn't feel the need to, or see the need to relate to the periphery. So it's a place of richness in many ways. And it's something that Toni Morrison has talked about a lot. And I'm in the US, I'm sure you guys know Morrison a lot. it's something she's talked about a lot, and about being in the periphery and the periphery being a rich place. And when she described her career, she used this expression that I stood at the border and claimed it as central and let the rest of the world move over to where I was. And for me, it speaks to the fact that this center-periphery distinction is not natural or neutral. It is constructed, and it can be reconstructed and unconstructed. But that distance, that gap as well, it was what Baldwin was talking about. I love this picture of them together. It's a rare picture, and I'd like to show it. What Baldwin was getting at when he talked about how ignorance allied with power is the most ferocious enemy justice can have. That when we set about trying to achieve justice in global health, and we do it from a distance, as we do things from a distance, we are ignorant of the periphery. We do stuff in the periphery anyway, and the assumptions we make are unjust in their consequence. Because justice requires a certain level of engagement and understanding that the distance that we've constructed between ourselves and the periphery leads us to doing justice. And I've sort of highlighted two ways in which that manifests, in which our analyses are based on the wrong assumptions very often. And in all analysis we do, we make assumptions. And when we are not making assumptions, especially from the knowledge of those who are on the periphery or looking at the world through their eyes, and being able to see ourselves as they see us, because that's another dimension of that injustice. We implement the wrong interventions when we do that, and we do that very often. And for me, there's also an important dignity element to this, which I will get to in a moment. But it also means that when we do that, when we make these assumptions on behalf of implement interventions on behalf of analyze people and their realities on behalf of, without respecting them as knowers and interpreters of knowledge, we also violate their dignity as knowers. And it's this idea of having dignity as a knower that I think it's a very important way of thinking about knowledge practices. That it's not just that we are doing harm by choosing the wrong interventions or writing the wrong analysis or focusing on the wrong ways of understanding people, but we're also doing something more fundamentally wrong and unjust, which is to violate their dignity as people who know things. Now, so that's my effort to define global health, which I'm sure doesn't sound like one that you're used to, but that's how I understand it. And so I'll also try and reframe. So there was a point that I should have made on this slide, which is about how Morrison made sense of her place on the border or the periphery. And she articulated that in a very interesting way, and it's never left me. This idea that she was writing for Black people. And it's different when you write. The audience you choose, it's such an important part of how you express yourself. And I began by sort of quoting Eliot when he sort of said that his effort at writing a poem was a radar being articulate. That there's a sense in which your audience co-constructs your message. There's this fine line by a Malian, I think now French literary theorist, Manthia Diawara, who said that every narration places the spectator in a position of agency, right? So you ascribe agency to your audience, and if you choose your audience in a particular way, then it also frames how you express yourself and what you express, and how understandable you are, right? So that what is inarticulate may become articulate in a sense. And I'll get to that later, but I wanted to make the point about audience, which I think is one of those elements that is often gets missing in how we think about global health and knowledge practices in global health. That we often assume a neutral audience, and our audiences are not neutral. They are audiences with agency, and those agencies are biased one way or another. And Morrison understood that. Yeah. So if you're familiar with the epistemic injustice literature, you will know that Fricke sort of identified two forms of epistemic injustice. One is testimonial, the other is hermeneutical, but I call it interpretive because hermeneutical is just all over the place, but interpretive you can understand because it's in prose. And so she sort of theorizes in a sense that testimonial injustice derives from credibility deficit that we ascribe to certain people or impose on certain people, or as a consequence of credibility excess that we ascribe to other people, such that their testimony overrides the testimony of those who we ascribe credibility deficit to. And the other form, the interpretive injustice form, stems from what she called interpretive marginalization, which essentially is what happens when the framing and the frameworks we use to express ourselves are not available to certain people to use, so that they can't communicate their reality, or they can't even understand what happens to them because the framings and the frameworks that allow them to do that are not available to them, or have not been made available in the, if you imagine that we exist in an epistemic pool where there are tools that we can use to communicate. Some people have more tools than others, and those who have less are less able to articulate what it is that concerns them, and to understand it and to communicate it. So, so those are the two forms that Frika sort of identified. And I like to qualify or reframe that framing slightly. One is that Frika sort of talked a lot about epistemic injustice in a very interpersonal way. Not only, but a lot. A lot of our framing and thinking is very interpersonal. But I think that there's a very important institutional element, structural element to epistemic injustice, right? That it's not just what happens between people, but what is caked into the institutions of society, so that a person doesn't need to want to be unjust to you, but the system within which they operate makes them unjust in their practices. So the first qualification that I think is important to make here is just the institutional dimension in addition to the individual. The second one is that I like very much, as I highlighted in the previous slide, about how Morrison talks about gaze, about audience, to separate epistemic injustices that are related to one's positionality or pose, as I like to call it, from that which is related to one's capability as an audience, or the gaze of knowledge that is being produced. So that's sort of two forms, in a sense, of how one might think about injustices that apply epistemically. So you can think, if you do economics or do math in a way that you do 2x2 table, you can see this as a 2x2 table. So there is credibility deficit and interpretive marginalization, and you have pose and gaze, and then you could apply. So there are sort of 4 cells there. I hear some of your epidemiologists and statisticians are just trying to make you happy. Yeah. So what we did with the literature was that we decided to hand search a selected number of journals over 5 years, 2017 to 2021. And we didn't do the traditional systematic review where you sort of have search terms, you throw them into the engine and it gives you stuff. And we didn't do that because we weren't looking for research papers primarily. We were looking for commentaries and editorials and correspondence and think pieces, things that weren't, that the search machine isn't optimized to identify. So we had to actually identify journals and search their back archives one after the other. And as you might expect, 90% of the manuscripts papers we found were in fact not research papers. So 12 journals, as you might guess already, BMJ Global Health was one of them. Lancet Global Health was one of them. And those 2 journals made up 74.5% of all the papers we found. I didn't expect it would be that many, and I should know, but I didn't expect. But there's lots in those 2 journals, especially BMJ Global Health. And then we searched 2 social science journals, Social Science and Medicine, which is old, and Medicine Anthropology Theory, which is relatively younger, but interesting. And then we searched 8 regional/local health and ethics journals, Australian Journal of Public Health, Australian New Zealand Journal of Public Health, American Journal of Public Health, European Journal of Public Health, Asian Bioethics Review, Indian Journal of Medical Ethics, Pan-African Medical Journal, Pan-American Medical Journal. Is that it? Anyway, 8. And yeah, so those were about 16% of all the papers. And we did that specifically because we were concerned that the conversations being had in global journals might be different from the ones being had in other journals. I still think it was a sensible assumption to make. Unfortunately, we didn't find enough papers to help us actually draw distinctions between those two groups of complaints literature. And in fact, there weren't as many complaints as you can see in those journals as there were in the global journals, and we could discuss why I think that is, but that's a longer story. But it was a large number of papers. We had 141 papers to read through, and 6 reviewers, 5 initially, and then I had to get my university to hire a postdoc for me. So the 6 reviewers in all, and sort of each person reviewed one, and then about 2/3 were reviewed by more than one person. And our analytical lens to this was, some of you may be familiar with the realist approach, which is sort of from critical realism, which is this idea that the things we observe in reality and the patterns of outcomes we see of interventions or social phenomena are a consequence of certain mechanisms that are not as visible, if visible at all, but often operate in the minds of people or in the structures of institutions, but are also contingent on the context within which they find themselves, right? So essentially, simple basic context plus mechanism equals outcomes. Very simple way to think about it. And it's a method, it's an approach that's been used a lot to sort of analyze complex social and health interventions, to sort of understand why it is they work, under what circumstances, why is it that different patterns of outcome in different places. So we thought we framed what the outcomes were here as the manifestations of unfair knowledge practices that were identified and described by authors of this complaints literature. And we sort of grouped them into credibility deficit and interpretive marginalization, and then we broke each under each post-gaze. So there were 4 categories. And then we also read the papers as we were identifying outcomes. We were also trying to understand to what conditions, to what contextual conditions the authors ascribed those manifestations of unfair knowledge practices. So we also then coded and identified a growing list of those, which we then ended up consolidating into a shorter list of contextual factors. And then we sort of read in between the lines, in most cases, to try and understand what mechanisms that were active in generating those outcomes, and that were being conditioned by those contextual factors. And often you sort of have to impute what is really going on from what you are reading and from the way the argument is being made as to why certain things are unfair, or to what the authors ascribe this unfairness and whose behavior and whether at the individual or institutional level. And because I'd mentioned Baldwin earlier, there's one example. If you've never seen this video, you should please see it. It's 12 minutes. It's a great video. It's hard to better Baldwin at articulating anything. But in this video, it's a great video to understand epistemic injustice. If you watch it, if this was a class of my students, I would say, watch this video and give me quotes that align with different forms of epistemic injustice. And it's just all the forms are in this video. And Baldwin gets to a point at the end. So it was in conversation with Paul Weiss, who was at the time Sterling professor at Yale. And Weiss was basically denying all of Baldwin's experiences. And he did that for about 10 minutes. Again, it's hard to be better than Baldwin at sort of making an argument, but Baldwin could not make an argument because this man just would turn away from it. It was classic epistemic injustice. You should watch the video. And at the end, Baldwin just lost it. And then he gave these 4 examples of how institutions in America, as he had experienced it, said, well, the man was saying to him, but racism is not, you focus too much on this thing. Like, it's nothing. And he said, there's a point where he said that you and I have more in common, right, than I have with, a white man who doesn't like literature. Anyway, so he was just throwing this completely, yeah. And then Baldwin sort of came to a point where he said, look, I don't know what most white people in America think, feel. I can only impute what they feel from the state of their institutions. And he gave 4 examples of institutions that leads him to feel the way he was articulating to whites. And it listed these institutions, and I'm not going to read it. But what he was doing there is something philosophers of science call retroduction, which is that you examine the evidence and you impute from that. You sort of draw inferences back, which is essentially what you do when you're trying to identify mechanisms. You impute, which was what Baldwin was doing here. Anyway, before I go to the result, I just want to highlight a little bit about what I mean by dignity, because I want you to see it, even though I won't be using the words in the next few slides. I want you to see what it means in the following slides. That to say that someone has dignity is to say that there are rights that they have because of certain ethically or morally important human features that they have. And one of those, as I said earlier, is that they are knowers. We as human beings, we know things, we learn, we make sense of what we know, we interpret our realities and the systems within which we have our being. So I was raised in a Christian home, so that I always have a biblical something, or this is my biblical something, have our being. Those who know the Bible can know where that comes from. So we have our beings in certain ways, and we interpret that. And if this feature is not respected, this feature that we have as individuals and as groups of people, or one's knowledge platforms, and I think it's important to talk about platforms here, not just one's feature as a knower, but also the platforms through which one communicates and converses as a knower, just as important in being regarded and respected. And when I say platforms, I mean platforms through which we exchange knowledge, through which we curate and knowledge and cultivate knowledge. So different platforms that we use for knowledge are just as important because they are situated. They are not neutral. And I often make this example that the New England Journal of Medicine is a Boston journal, or the Lancet is a British journal. In fact, it was an English one before it became British journal. And that these are situated platforms. And the Lancet cannot do for Nigeria what it does for Britain. It just can't. Just as the New England Journal cannot do for Mexico or wherever else, what it does for this space. So in other words, in addition to being knowers as individuals, as groups and as located people, we also have platforms around which we gather to share knowledge, to learn from one another, to communicate. And that platform can just be as virtual as it is physical. And again, going back to the Morrison example, that she chose to write for Black people. She's choosing her platform, even though she's publishing in mainstream press, she's choosing a certain way of imagining what the space within which that communication is operating. Yeah. So I won't go into all the details of the results because we'll spend a long time doing that. But essentially under each of them, we identified 3 mechanisms under each manifestation, each outcome category, as it were. And I do love symmetry, but I promise you that I wasn't looking for just 3. I was hoping that there would be a consistent number of things, and it did happen. And again, believe me if you want, it did happen that there were just 3 under each category. And under credibility deficit related to pose, there were sort of 3 manifestations of that. And I'll try and describe each with examples. What I've done is to put words in the mouth of people who are committing epistemic injustice, in a sense to make it more real for people, how this actually really operates, which is to impute what it is that they're saying without often necessarily saying it about knowledge. So the first mechanism under credibility that's related to post is that the periphery's cultural knowledge is not legitimate. So when, for example, one enters a space and assumes people there do not have a way of thinking about XYZ before you arrived there, Or when we make claims about human concepts like freedom and liberty, and we say that it has only come from one place, or it could only come from one place. We'll just make these assumptions about how people have organized and lived their lives over millennia that completely erases the fact that they think and they know things and they interpret things. Again, you'd find a lot of this in literature. It's lots of it in literature. So the second mechanism is that the periphery's technical knowledge is not legitimate. Now, this manifests a lot more in global health partnerships, right? Or just public health partnerships, where you're doing a study. If I give a very interesting example that we're using in the paper, is when someone from the center, however defined, enters a space, and only people at the center are allowed to do technical things. So people on the periphery just collect data, right? And they pass it on, and that is their role. Whereas again, that is making huge assumptions about what they know and what they can know and what, yeah. So this happens again a lot. Or in fact, the third form of this is articulation of knowledge, which is their role in either being the people who write and so go through that interpretive exercise of writing, or people who are the ones who write the grants or decide the parameters of how you actually think about the knowledge process that you've been involved in. Now, I was going to make a comment here that in the literature, in the complaints literature, one of the dominant complaints is around authorship. And part of the reasons why I'm being keen to do this work is just to show how little that matters in the grand scheme of things. Right? It is ground zero. Right? It is the least. It's the least anybody can do. The bare minimum you can do is to think seriously about fairness in the space of authorship. It's, to my extreme discomfort, often talked about as the thing, and it's not the thing. And I'm hoping that what I'm presenting shows very clearly that it is not the thing. It is a thing, an important thing, but there are far more important things that sometimes manifest as authorship imbalances. But it's more important are the things going on underneath. Those things we see, those things we can count. And authorship is important because we can count it, because we can ascribe affiliation and can even guess a person's background by sort of their name, etc., or their gender. But it's such a little part of the broader landscape of unfair knowledge practices. So anyway, second outcome is credibility that's related to gaze. And again, the first mechanism here refers to the learning needs of people at the periphery, right? So when you do a study, are you actually addressing their learning needs? Or have you decided who needs to know stuff and then you're feeding those people's learning needs? And again, often those of us at the center, we feed the center's learning needs, which is often not. As I described earlier, the periphery is a rich place of knowledge. If you're addressing its learning needs, you'll be addressing completely different set of things. Your study will be different, your question will be different, your methods will almost certainly be different. Just as well as the periphery's knowledge platforms, and I described platforms earlier, which again is an important part of how one thinks about the knowledge that is being generated, right? On which platform am I going to place this? And does the periphery's knowledge platform have value, and do you think about it and take it seriously? And the third one is the periphery standards of scholarly quality are irrelevant. We had an interesting chat about scholarly quality last night. But essentially, what a person in Durban, South Africa, thinks of as of high quality in a scholarly way will likely be different from what someone in England thinks of as high quality in scholarly communication, for example, or even analysis. But we assume that it is what the person in London wants that should define how we go about trying to define whom we are trying to impress and what quality we are trying to aspire to. The interpretive ones. So interpretive marginalization related to pose. So again, there are three forms of this. And the first one is about how people at the periphery make sense of what knowledge partnerships should look like, which is an interpretive exercise. And if you ask people at the periphery what is it that you want to know? And a lot of the papers that sort of made this point were by indigenous scholars in Australia and in Latin America. So making the point that what we expect, what we want, what knowledge partnerships mean for us is not typically what it means for those who are trying to engage with us. So just that the ability to interpret and make sense of what partnerships look like, and for that to be regarded. The second is how people at the periphery make sense of issues just generally, especially issues that affect them, problems, challenges, and their solutions. Again, very often those of us at the center approach periphery spaces as though their own sense making of their issues do not matter. And the third one is that the periphery sense making of social reality. So not just problems now, but just how they imagine social organization works, how they imagine health and knowledge systems works. Just broader sense making does not matter. The fourth category of outcomes is around interpretive marginalization related to gaze. And the first one there is that, again, going back to learning needs, that again, the center's learning needs must drive sense making. And what a lot of the papers here, we're talking about how we construct our research and construct knowledge to fill certain gaps in the framing, or at least to address how an audience might frame an issue. And when we do that and we defer to the center in doing that, we also de-optimize ourselves, as it were, for addressing how people at the periphery might otherwise frame whatever it is that we are addressing. The second and the third mechanisms here speak in many ways to entrenched power, especially at the center. That a lot of how we go about crafting knowledge and deciding what is worth studying and deciding what methods are worth using and how we use them are often optimized to assuage the sensitivities of powerful people. Again, I can go to many examples of that. But just when you analyze, for example, why, and Eugene talks about this a lot, when we analyze why there are infectious diseases in a particular place, and we analyze it, we go downstream. Because downstream makes either us or the people we're trying to write for or the people who have given us money comfortable. And the same applies with the third mechanism here, which is that a lot of, again, our sense making and framing and interpretation of things are in a way that do not sort of threaten the entrenched power interests of people at the center. So it's one thing to make someone uncomfortable socially, right? People want to feel like they're being great and cool and kind and saving the world. But it's another thing to actually make them feel like your power is illegitimate and you should, bugger off. So those are two different mechanisms, but again, both about interpretive marginalization. Because when we do that, again, what we're doing is limiting, in a sense, the ability of people at the periphery to either articulate what it is that concerns them, or for those who are at the center to understand it when they articulate, right? Because we've centralized certain kinds of framings and interpretations and methods in the literature or in our conversations. So those are the sort of 12 sets of mechanisms that we identified. And then to go to the conditions that then enable each of these mechanisms. So typically in reality analysis, you would sort of have one contextual factor influence one mechanism, influence one outcome. But here, I just couldn't disentangle those conditions. They're all sort of self-mutually reinforcing, overlapping, almost in a ring, all 6 of them. And the first one is about compounded spoils. So this idea that those who have will have more. Again, the center that is dominant, the Lancet, for example, we have more. unless you actually put a stop or you do something to reverse that. In other words, there's a contextual condition that is such that the powerful gets to have more power unless you stop it. And that, when I was sort of writing that framing, I was thinking about Billie Holiday's song, God bless the child who's got his own. Them that get shall have, them that not shall lose. The second one is colonial mentality, which is again is the sense that is often present in the periphery, that the periphery is just not good enough. Again, often stemming from long history of colonial subjugation and oppression. I thought that even when the center leaves, but the center never really leaves, but when the center leaves, you still feel that way. And I was thinking a lot about a song by Fela Kuti called Colo Mentality. Yeah, and so he sings in pidgin, then don't release you, but you never release yourself. The third one is miseducation. I was thinking about Lauryn Hill when I was writing this one, which essentially speaks to the ways in which how we educate people who go ahead to perform knowledge. In many ways, are in a way that defaults them to epistemic injustices. We train people to be epistemically unjust. And if we want to right a lot of these wrongs, we would have to change how we train people. It's so fundamental here. The fourth one is mislabeling, which is the ways in which we ascribe categories to different types of people or situations in ways that then allow us to stereotype them or not analyze them clearly enough, or that just basically confuse our analysis. And a lot of the papers talked about the LMIC category here. Often it doesn't make any sense. Or describing people as vulnerable, and sometimes even as minority. When we describe people as vulnerable, we often let off the hook the people and institutions that make them vulnerable in the first place. So if we describe them instead as someone made vulnerable, it means something different, which then allows us to do a different kind of analysis than just, okay, they're vulnerable, not to be questioned, and then let's then go downstream further from that. The fifth one is under governance. Again, speaking to the idea that very often in these spaces of knowledge making, use, sharing, there are very few rules to govern those spaces. And even when there are rules to govern them for justice, they're often not implemented, not monitored, not enforced. But for the most part, there are rules. And that includes how ethics committees and IRBs work. But you can look at many levels of the governance of knowledge practices and see how there are just big gaps there. And again, the gaps that if you thought carefully about filling them, perhaps we can reorient some of our practices towards justice. And the last one is underrepresentation, which is again something often talked about, and that manifests in different ways. Representation on review boards in the governance space, but also in the academic space, in the journal space, all sorts of spaces, and how people at the periphery, when they are not there, are not in a place to make rules that actually defaults the system or constrain the system to justice. Yeah. So in that poem, Eliot's poem where I started, toward the end of the poem, in the fourth part of the quartet, he sort of went back to this idea that he was struggling to articulate himself, and sort of said that at the end of all our exploring will be to arrive where we started and know the place for the first time, that which was not known because not looked for, but heard, half heard, in the stillness between two waves of the sea. And for me, it's I take the part not known because not looked for seriously. Because when we think about dignity and epistemic injustices, one of the reasons why it is inarticulate, as it were, is that it's not what the center has looked for necessarily, because the center can afford to not care about the injustice that it inflicts on people. So that's one of the reasons why I think issues of epistemic injustice in global health have taken a long time to actually be talked about so well and so profusely. But also, I think because it is complex and it has many multiple moving parts, as I've tried to highlight in this talk. And if you are a knower who has been who has had epistemic injustice inflicted upon you, it's even harder to begin to articulate different moving parts and elements of this injustice. So I think for me, making these forms and manifestations of injustice really clear is a worthy goal and is in many ways a justice affirming practice, which is why, in fact, we did this to hopefully more clearly delineate and highlight and articulate the different angles and contours of this injustice so that we can, again, begin to think more clearly about how we achieve justice. I just wanted to thank my friends and co-authors who have gone on this journey with me, and also the people who put the money on the table. Thank you.
Thanks so much for sharing that with us. And I really appreciate how you brought in diverse voices and helping us understand what epistemic injustice is in global health. I myself just finished Song of Solomon by Toni Morrison on the audiobook that she reads herself, and it was, mind-blowing. And I can't think of any better example of, starting to wrap your hand around what epistemic justice looks like than that experience. But now we have some time for questions and discussion. So there's microphones out on the tables for people that would like to ask a question here, and then I'll read some from those online. Chat doesn't work, just type them in the Q&A, please.
Who's going to go first? Okay.
Oh, okay. Thank you. That was really phenomenal. And I follow a lot of the writing on this doctrine in pediatric global health at MGH. I was curious in the complaints literature whether we saw any differences in what we were reading across regions. And I ask this because I ponder a lot about my own work as an Indian who works in India. And it is surprising to me that actually a lot of the complaints literature comes from journals like yours, and that local journals, you probably are not finding much of that because it is written for an Indian audience, at least in terms of the Indian journals. But what I'm also really struck by, actually, this jumped out at me at a recent NEJM article written on global health equity, is really how much disparity there is in terms of funding that actually goes to different parts of the world. So I'm going to read from the article this is from 2022 NIH funding. 40 million went to South Africa, 12 million went to Uganda, and in contrast, 500,000 went to Bangladesh and 500,000 went to India. So I just wonder, just putting all of this into context, whether you're seeing any regional differences or at least nuances in how the complaints literature has been described.
It was hard to see the nuances, in part because we didn't find a large number from especially regional journals. An important distinction that we found, which I mentioned earlier, is just the places that where indigenous peoples are more vocal, had more literature talking about indigenous peoples specifically, which there were much fewer of those in the sort of global journals. But I think they're just as important in making sense of injustices around global health. On the question of, I was surprised. I was hoping to see lots of papers in the Indian Journal of Medical Ethics, and I didn't. I think it's only 4. But there were lots of Indians who wrote in the Lancet and BMJ Global Health. Right? And that also says something about whom the audience of the complaints are, legitimately in this case, that the people we want to fight or we want to complain to and about, belong in the spaces where the Lancet and BMJ operate. So we happen to write our complaints there. So that makes sense too, which is partly why, hopefully, I was remarking last night that I hope a probing reviewer doesn't ask us to analyze the different, analyze by origin or by journal what the different types of complaints are, because it's hard to do that in a sensible way, because people are speaking to different audiences about different issues, and it's only normal and expected that Indians complaining about global health, especially, would place the complaint in the Lancet or the BMJ. I found more sort of methodological complaints in places like social science and medicine anthropology theory. The complaints there were more theoretical and methodological, which again wasn't much of a surprise. You expect that. Again, when you read the names of the people writing these complaints, they're typically from different parts of the global south. Right? So it's a lot of the complaints literature is authored by people who, for one reason or another, you would expect have complaints to make. There was an interesting complaint, especially from South Asia, about language. And there were different forms of the complaints about language, which I found really interesting. So there were some complaints about language of how a health system operates. So in a country where only 9% of people speak English, everything in the health system is in English. And again, the incalculable harm that does to health. No one can put a number to it. No one has put a number to it. But just this downstream long-term consequences of colonization on health, it just outside of anything that anyone would do, to harm, just the choice of language and the epistemic harm that does, because you can't express yourself, you can't be understood. It's all of those things. Yeah. So there are also those kinds of complaints. In addition to, of course, the complaints about language and where you get published, who get to read your paper, or even if you can speak at conferences. There was this complaint from West Africa, Francophone West Africa, about how, if you're in a conference, you just keep quiet. You better keep quiet, was how this person described it. Because you will struggle to articulate what you want to say, and then you're embarrassed. So there are all these different forms of structurally conditioned injustices that are just there. And there are, again, injustices that operate because we've made certain choices about how the world is going to be organized. And then it manifests in that way.
Like everyone, a huge fan. Been following you for a long time. Can I ask a question that isn't directly related to? Something that I think it troubles me, and I would just hopefully others would love to hear your perspective on what I conceive of as a radical transformative project. You're a voice, a leader for changing institutions, changing everything that's constructed around us in a really radical way. And yet we sit hampered and hamstrung by institutional inertia, entrenched interests, power, X, Y, and Z. You sit in a number of different positions as an academic, as an editor, as a practitioner, and yet you face these things, these structures, these impediments, these barriers all the time. And I'm just curious, experientially, how you navigate that constant, what feels like to me at least, and probably others, fight, and what gives you hope that this is the beginning of a transformation versus where I tend to retreat pessimism, that this is not nearly enough, and a lot more has to happen, and the people who sit in positions of power are so reluctant to embrace changes without some incentives really changing fundamentally. So I'll stop there. I hope you get the gist of my question.
Yeah, I do. I try to be playful, and that helps me mentally, helps my mental health. Even if I'm fighting you, I sometimes will laugh with you and then try and aim for a metaphorical punch. But and that helps. It helps with the fight, just on that topic of the fight. And I derive immense joy from writing. And I like this shape of paragraphs, and I like to make my paragraphs look pretty, and my sentences look pretty, and that makes me happy. And that for me is a huge part of how I cook. It gives me joy. I'm not often as optimistic about things Every once in a while, something happens that makes you feel like, okay, maybe the system is weaker than I thought it was. But it doesn't happen all the time. And when it happens, again, that gives me extreme joy. And every once in a while, you see that it might be possible to shift certain things. And Eugene was describing earlier a grant that I just received late last year to do some work, and the work speaks to exactly that. That I've been very interested for a long time since I was a medical student in how the evidence-based medicine movement managed to be so successful. Now, I'm not a huge fan of their success, but I'm a huge fan of the fact that they were successful. And I'm keen to study that and as a way to think through how the strategies we might be thinking about in this space to bring about success. And again, if you can I'll give you just one example of what they did. So if you look in the late 90s, mid-90s to sort of mid-2000s, all the major general medical journals in the world, except New England Journal of Medicine, I should say, because I'm in Boston, except the New England Journal of Medicine, was publishing a series of articles about evidence-based medicine. The series ran for years in the BMJ and in JAMA, years and years. The archive is there. They were so evangelical about education. Evangelical is the word. It got to me in Nigeria in the early 2000s. That was how successful they were evangelically. They made arguments publicly. They were fierce. They didn't back down. They had opponents and they had arguments ready. And I'm a huge fan of that kind of willingness to fight over things and be successful. And I'm really keen to just more systematically study how that happened. Because it happened once, maybe it can happen again, maybe. So I sort of break down my troubles in these ways. Yeah.
Hi, I'm Anne. Oh, okay. I'm Ann Stevenson. I work at Harvard School of Public Health and the Broad Institute, which is a genetics research institute. I think that this audience is probably a group of people who are like-minded with your work. How would you recommend getting out of this bubble? And particularly, I'm interested in your work, but also social justice in terms of a biomedical research framework. Sometimes I feel like I'm the lone person in the room thinking about those things, and it's lonely.
On preaching to the choir, I was chatting to about to start medical students at Harvard Medical School last night, and I was saying something very similar to him about this issue, that I think, again, I'm a huge fan of people who are successful at changing things, or at least maintaining something they want maintained. And I was making an example of the neoliberal movement in the US. And I mean that broadly, but people who made arguments on the right, especially preceding and at the height of Reagan and Thatcher's administrations. That if you observe them closely, if you read their works and you observe what they do, they preach to the choir again and again and again. There's a lot to be said for reiterating. It's what happens in the church. Again, I said, because I grew up in the church. So what happens in the church? You are made to not forget. And you also, in that process, you're optimistic about just convincing one more person. One more person is a win. And we often don't think about it that way. But if I get one person today, this is a huge success. So choir, fine, thank you very much. That one person, thank you too. So I believe in preaching to the choir, frankly. I think it's important. It makes you feel less lonely too. So there's a lot to be said for that. Now, to your specific loneliness, which is a peculiar one. When I think about biomedicine, I often, in my mind, when I'm thinking about knowledge platforms and practices, there are things that are peculiar to biomedicine that don't necessarily apply when we're thinking policy systems and reforms and equity in that space. So there are peculiar things. But there are also, in many ways, deep assumptions that color how we interpret things that are deeply, embedded in how society works, racism and the structural exclusions that manifest in the kind of research that you do. And I suspect, and I have no evidence, but I suspect that part of the reasons for that is miseducation. I think that a lot of how biomedicine is taught, again, completely ignores anything that is upstream. It's not there. It begins in the biology and it goes down from there. And if you have the power to train people differently, that may be your first congregation. And then you may build a choir and then expand. But I really do think that a big problem with biomedical sciences broadly is education. As with a lot of other things, frankly, as with epidemiology and biostatistics, I think it's training. It's people get trained to think and work in a particular way. Certain kinds of practices are modeled for people. And then that continues to generate and regenerate itself. So when I'm thinking of sort of breaking these cycles, I'm thinking of the classroom primarily, which is also, to the earlier question, one of the spaces in which I find the most joy, the classrooms. I teach a lot at the University of Sydney. I teach the Introduction to Global Health, and I use that as a podium to preach and preach and preach. And that gives me extreme joy. So yeah.
Oh, sorry.
Okay, thanks so much, Seye. I have two questions from our colleagues online. The first is from Dr. Vedem, and she asks, she'd like to know your thoughts on how, as scientists, we can start empowering marginalized communities, value diverse knowledge systems, and promote inclusive practices. How can we work towards a more equitable and just global health landscape? Who starts this process, and how do we champion the movement?
So this is the kind of question that sort of makes you a way to think about this question is that there are multiple points of intervention. Right? It's the way in which we've been educated. Again, going back to miseducation, we're often educated to think in linear, so straightforward, one thing, next thing, next thing. But often the world is far too complex for that. And so there are many nodes around which one may begin to do things differently. For me, one of the most important is education, as I mentioned earlier, but just how a person decides to write their grant, for example, or how one chooses one's methods. Again, I recognize really well how much of that is conditioned by what a funder wants. Or how much that is considered by what our career wants, which means what our institutions want from us. And very often we choose methods that funders will give us lots of money to use, or that a big journal will publish, which is good for our career, and then the next thing and the next thing. So there's a whole ecosystem designed for injustice, essentially, as the world is. And so you can't just start it in one place. I will advocate to journal editors, and I'd like to, I'm often in spaces that are less public, in which I do some advocacy, journal editors, but also some publicly, to publish a broader range of methods, so that it allows academics to actually want to use different methods, which allows them to be more just in listening to and responding to the people they should be listening to and responding to. I advocate and I'm working toward having more journals, proper recognition for journals in different parts of the world that just de-emphasize the attention and power that a BMJ Global Health or a Lancet has, which I think it's one of those, it's really unjust power. It shouldn't, this journals shouldn't have more than, say, 5% of their power. It's just too unnecessarily powerful, again, because of the way the world is constructed. And that the more of them we have, and the more we encourage and support and create conditions that allow people to focus more in other spaces, the more just we can be. It's also, I mean, a lot of this is also researchers. You know, I know us researchers like to point fingers at funders, and it's all good to do that. But every now and again, I sort of look at research and I say, you guys are powerful. You convince yourself you're not powerful, but you are powerful. And what the funders ask for, in many instances, are what senior researchers have asked them to ask for. The funders are not asking for these things in a vacuum. Some people have told them that this is what you should expect, right? So we can also break that cycle. It's not impossible. But I've made this example every now and again that, you know, the next time the Gates Foundation asks you to do something stupid, you can write a collective piece to say, the Gates Foundation, you ask us to do something stupid, we don't want to do it. Can you ask us to do something else? You can do that. You can do that. There was a recent call from the Gates Foundation, I think it was sometime last year, where they said they were looking for innovations that could scale. And then one of the conditions was that the innovation should not be something that currently exists in the country. And that's really stupid, right? When you think about it. An innovation that could scale, but that doesn't exist in the country. So I mean, there are these clearly black and white, stupid things. And we can push back. We can push back. There are powerful people in this room. You guys know powerful people. Right? So there are also all of these, there are many ways to begin to think about how to respond that are not just, you know, just one person or just one. Anyways, and we have power and responsibility. And sometimes I don't think we are aware of it, or maybe we've been told we don't have it, so we just believe we don't have it. Or we're so drunk on the power that it's just so much fun to keep doing what we've always done. But we can pull back and actually think again.
Thanks, Seye. Let's do one more from online and then we'll move back to the room. This one's from the newly appointed Dr. Zerwinski, who just finished her PhD in anthropology here and delivered a brilliant thesis on modeling in a post-truth age. And so I'll recommend that to everybody when it comes out in book form.
Eugene is preaching.
Can you say more about the economics of global health knowledge, as you've been touching on, how it affects the complaints literature? In particular, what do we make of the fact that those who produce knowledge about, for example, poor people in the periphery are at the same time generating comparatively enormous amounts of wealth and prestige for themselves? What is or should be the obligation or concern of the knowledge producer in relation to the unequal economics of those who complain in prestige journals versus those who live out the conditions of complained about?
So there are many different axes of inequity that manifest in these complaints. There were complaints about gender, whether it's in representation on journals or what is published, or how much they are cited, that would affect the person complaining directly. That may also have economic implications. There were also complaints about people, there are complaints on behalf of, there are complaints by sort of people who are saying, we're not listening to people in the community enough. So there are complaints that people made about themselves and also complaints on behalf of other people in this literature. There was something you said last night, which was the first time I thought about it. And I'm not sure you noticed that I heard it because I'd gone to get a drink and then you said it when I just arrived. And it was that in an equal world, we won't be doing social science. That in many ways, social science either serves to obscure the fact that the world is unequal or serves to explain why it's unequal. But in an equal world, a lot of what we do will not be necessary, which means that at whatever level, someone will need to speak on behalf of other people. Someone will need to articulate some things. Someone will need to expose the things that obscure, right? As long as there are inequities in the world. And that means that there has to be the ethics of doing that, which again, I promise you, do not currently exist, right? So the ethics of actually doing all of this. Philosophers are talking about it more and more now. Bioethicists are talking about it slightly more now. but just how one thinks about it. And I don't know how to think about it in a comprehensive way yet, but how one thinks about what it means, what the obligations are in clear ways, of speaking on behalf of other people or even on behalf of oneself, whether describing inequities or unfair practices such as this. And I'll be keen, frankly, for someone to invest their time in thinking through that and making that something that people want to talk about. That there ought to be. So so if you are familiar with the research ethics literature, especially from ethicists and bioethicists, one of the things that strikes you in that literature is just how completely inattentive it is to inequities. Like completely inattentive to it. And I think, again, that part of what all of this discussion, I hope, will lead to, again, that was the condition I meant by under-governance, that this is an under-governed issue. And that we need to work our way to a place where there are actually clear rules around how one might engage in this space.
Okay, thank you so much. My name is Rashi Jinjinwala. I'm a surgery resident at Beth Israel, just across the street, and the outgoing chief fellow at the program in global surgery and social change. I'm so honored to be here. Thank you so much for coming. I have what may be quite a simple question. So at the program in global surgery and social change, speaking of preaching to the choir, we've been doing an anti-racism curriculum for the past 3 years, and it seems like there's a decent amount of buy-in from the bleeding hearts who choose to spend their research time working on issues of global justice. I've been trying to also do this with my surgical co-residents. My question for you is, how do you, with the education point, how do you create buy-in? How practically have you been able to create buy-in? I know you have your introduction to global health class, which again is a little bit preaching to the choir, but when you have a group of surgical residents who are here to learn how to operate and potentially are in that more biomedical side of, starting at the organ level, how do you practically create understanding and interest in the issues that are more broad?
As I will say something that you already know, which is that it is difficult. I will go back to the evidence-based medicine people to find an answer for you. When they started, they has assumed that every doctor would want to know how to do a randomized control trial and would do it and be able to read the report of a trial and interpret it and use it clinically. Right? That was their assumption. Then they found and admitted sometime in 2007 that doctors weren't interested in that. The doctors just wanted a protocol, an algorithm. Do A, do B, don't do A, don't do C. That's all. Boil down to that. And of course, they had assumed doctors are the smartest people in the world, blah, blah, blah. They are really smart, and so they would be willing to do all of these things, but they weren't. And I'm giving that example in part because there will be something to be said. There's something to be said for creating a curriculum that is readable, that is basic enough, that you share again and again. And you create forums for people to at least have contact with again and again. Something really simple, in the hope that it leads to something more complex. But I think a lot of people, and this has been an experience where I work, a lot of people want you to give them rules. What I often say to them is, you really have to come to this thing yourself and really actually deeply engage, etc. Which is true, but I have to recognize sort of deep down in my soul that maybe that might work for 10% of the people. That the vast majority of the people you want to engage with this material and thinking, you may need to start with a simple protocol, 3-4 pages, and I hope that maybe out of that sort of 80% of people, maybe you get another 20% who want to go for that. Maybe others are stuck, maybe others. So again, to the earlier question, I tend to not expect too much. And again, that is helpful.
Thank you so much. I'm Louise Ivers. I'm the director of the Harvard Global Health Institute, and I work at Mass General
You
Hospital.
have many global health things at Harvard.
Many, so many. That's part of the problem. I just wanted to say thank you first for your leading voice on helping even maybe the choir articulate the issues. And I really resonated, your talk today really resonated with me, and I really appreciate your work. And I think for many of us, it helps us to articulate the issues that we have not been able to articulate about the problem that we have seen and experienced. So I just wanted to say that.
Thank you.
I'd love to get your thoughts. Since coloniality really participated and supported and structured racism, and racism and coloniality are so interlocked, I wonder how you think about those things together, those things separately, and how they relate in the work that you do, because you alluded to some of the racism in your conversation, but I'm wondering how you structured that thinking. Thanks.
Okay, so American racism is peculiar racism. There's an American brand of racism. And I remind myself of that again and again, that there's an American brand, which frightens me in a special way. And when I'm trying to think about the world, I'm trying not to bring that American framing of racism as an analytical lens for the rest of the world, right? Which is why you won't hear me talk about racism a lot in this context. Racism is a force and a factor, and certainly not the only one involved in this, what I'm describing here. And when it manifests in certain specific ways and along certain axes. But it's and in many ways it's in the background. Right? So when I know there are Nigerians online. I'm going to talk about Nigeria now. So I know Nigerians who have come to the US and have sort of said that it was the first time they were experiencing racism. And that is true, but it's not the first time they're experiencing racism. Right? There is, first, their existence as Nigeria itself stems from a version of racism, right? Which is bound up with colonization. But there's colorism, which again stems from a lot of that. Even how women's hair is reckoned with in Nigeria stems from that, right? So there's a sense in which racism manifests in that kind of American one-on-one, not just America, but again, the version here is special. And there's also that sort of backdrop to a lot of other things in which it's bound up with colonization and the justifications that were made for colonial expansion and conquest and pillage. So I try to separate those two things in some way. And sometimes, certainly in this kind of analysis that I've just described, part of what I'm going for, again, going back to how to articulate things, is how to articulate things in clear, specific enough ways that then lead to very clear, specific actions, or at least that allows me to convict someone of having been unjust, or to recommend what a reparative action might look like, right? And again, in that space, I don't go very far when I say don't be racist. It's important, of course, I shouldn't need to say it, but in trying to articulate, again, how to convict a person of an unjust practice, or how to think about repairing it, they exist at in certain forms and ways that require a certain kind of articulation, if that makes sense.
Thanks so much. You alluded at the beginning of your talk, and then in the last couple of days you mentioned it as well, that the term global health is flawed, and we're a Department of Global Health. I wonder if you think we should change our name to a Department of Local Health, and if that would be useful, or in
Department of what, sorry?
A Department of Local Health.
Local.
But really what I'm asking is, can you share a little bit more about the tension between the universal approach to global health and the needs of local communities, and the needs for local communities to have power in this relationship. And how does the university department like ours, how should we address that?
My first, the first time I had a problem with the term global health, I was working in the Ministry of Health in Nigeria in an agency called the National Primary Healthcare Development Agency, with which I maintain relationships. And people who come to Nigeria and they say they're doing global health. And I would wonder, because they're doing exactly what I'm doing too. And I'm not saying I'm doing global health, right? So what is it, what makes what they're doing global and what makes what I'm doing not global? So that was the beginning of my concern about the time that he described something that I'm not sure is philosophically defensible, or is actually true, or is saying what it means to say. Right? So that was my first problem with the term global health, is that it's describing an activity, to my understanding, that speaks to inequities, that reducing, eliminating inequities in the world, which could be done by anybody, from anywhere, going anywhere, right? So for me, the first problem was just who says they are doing global health, and why they lay claim to such a label. The other concern that I have about global health is that once you say global health, we think international. And that means that it takes our attention away from other axes of inequities, right, that exist in different societies, right? We think international, but we also think low and middle income countries. Right? But within countries, whether high or low or middle income, there are these inequities that speak to the same concerns. And it just, again, I was describing mislabeling as a condition earlier. That mislabeling just confuses how we think about the world. We can't think clearly because of the labels we take to the world, including that label global. On the question of what the department should do, I honestly think it's too early to do anything. So people at the London School of Hygiene and Tropical Medicine have asked me this question before. And I said to them, half jokingly, that I want you to keep your name so that it reminds you of where you come from. Because the London School of Hygiene and Tropical Medicine, the name itself carries a weight of history that I wish would never go away. I just want that label to be there forever, to remind them where they've come from. I don't think you have that kind of history here necessarily in terms of time. I think your global health department is relatively recent. It doesn't mean that the name is changeable in ways that perhaps the London School's name is harder to change. But I think it's too early. And I don't like the word glocal. It's just, a student of mine once asked me when she heard me talk like this, and so said, and they're doing the master's in global health. You can imagine how much angst I cause students when I say things about global health, when they're going to get a degree with global health in it, on it. And then this student asked me, so what will you change it to? And I said, perhaps you might think of it, maybe later, a master's in health equity. Something that sort of speaks more directly to what it is being reckoned. This is, and also hopefully makes us understand that this is more clearly that it's political and structural in ways that, again, global health doesn't necessarily invite us to contend with.
All right, I think we have time for about one more question, so.
Thank you. Thank you. My name is Anahi. I am a Global Health Fellow at Boston Children's, Pediatric Global Health Fellow, and just graduated from the Master's Program at Global Health here in the department. And my short-lived, but my experience so far in global health has been with indigenous communities in Mexico and Guatemala. I am from Mexico, and I'm really interested in this notion of just what we see as and what we validate as knowledge and why, especially thinking about the communities I've worked with and tried to partnered with. And so this might be, I apologize if this question is kind of like a reinterpretation of other questions that other people have done made in the room, but I just, how do you see the evolution of our methods of validation and our interpretive frameworks? Do you see a change so far, and how do you see that change coming into it, particularly as you're in your role as a editor-in-chief of a major? How do you see this change of like this whole peer review process of who validates what's consolidated as knowledge and why, and how do we continue to step into this change?
I think editors have a lot of power.
What's that?
So editors have a lot of power, so I'm acknowledging my power. Yeah, and often can be arbiters of what makes it to publication. And I think in many ways, and I speak as someone who is an academic who also sends his work to other journals, so I don't have all the power. Other editors reject my work. As someone who also is an academic, which also means for me that what an editor wants to see published would almost always be published. So I can know how to find reviewers for a piece of work that will make it unpublishable. And I know how to find reviewers for a piece of work that will make it extremely publishable. Right? And that's a very subtle form of power that nobody ever gets to notice or talk about. And I found that certain kinds of work, especially certain kinds of methods that are more just, as it were, or that are tuned to answering important questions, easily do not make it through, especially elite journals, to publication, in part because the editors are afraid they won't be cited, and editors want papers to be cited because that helps their impact factor, or because editors think someone else is looking and we sort of think that they have become woke. I know editors who think that way. So there's a big role for editors in sort of just trying to place certain methods in front of you. And the method that we used for this paper that I presented to you, realist methods, which is really useful for thinking about complexity, was developed in part as a counter-argument to the belief that randomized control trials of complex interventions make sense, because they don't. And that what often matters is how one navigates and makes sense of the complexity within those, which then means that you actually have to find ways of theorizing your intervention in ways that allow people who are involved in them to be co-theorizers. Right? So in other words, that there are methods and there are innovations, but again, if I submitted this paper or a paper using this method to analyze a complex intervention to the New England Journal of Medicine or to the Lancet, it would not be accepted. If I want them to be accepted in those journals, I may have to lobby the editor. And again, people have done that. And you should perhaps consider doing that when you really feel strongly about something. But a lot of this particular thing you're talking about rests with editors. A lot of it also rests with again, going back to education, people are still taught today, and they will be taught for much longer, that you can do an RCT of the complexity, and that the result will tell you something that makes sense. But it won't. And I know what I've just said is controversial, in that there are people who will hate what I've just said because they make a lot of career and a lot of grants from this kind of approaches to things. But it doesn't make sense, and they know. But they won't stop because that's where the grant money is. So, long story short, I'm talking like a Nigerian now. Long story short, do your best work. Find journals that have editors that listen. Lobby journals if you can. Really consider doing that. Yeah, and good luck.
Well, thanks so much, Seye, for this riveting presentation and for editing a journal that listens. We're in debt to you. And so if we could just give him a round of applause for joining us today. Thanks so much to everybody for joining and those online, and a special thanks to Scott and Amy and our department team for organizing, and have a great day.